So in assessing the blood pressure, first assess the patient for the signs and symptoms for hypertension and or hypotension and the factors affecting the blood pressure. Then assemble all equipments and supplies. So the stethoscope, the sphygmomanometer with the appropriate size of blood pressure cuff, my record book, and the antiseptic wipes. Then explain to the patient what you are going to do, why it is necessary, and how he can cooperate. Then wash your hands and observe any appropriate infection control procedure. Then provide the patient's privacy. So I will close the door, and for the adult, it should be setting position. So the feet should be flat on the floor, and then the elbow slightly flex with the arm facing up, and the forearm supported at the level of the heart. Then wrap the deflated cuff in the upper arm. So locate the bronchial artery, palpate it with your 2 fingertips. So, dito po siya. Then, place the center of the cuff over the bronchial artery. So for the adult, the lower of the cuff should be 2.5 centimeter or 1 inch from the antecubital space. So this is the antecubital space. The center of the cuff is directly over the bronchial artery. Then close the valve by turning the lock clockwise, and then lapit ko lang. And then pump up the cuff until you no longer feel the bronchial pulse. At that pressure, the blood cannot flow through the artery. Then release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 millimeter mercury per second. As the pressure falls, identify the manometer reading at each of the 5 phases if possible. Deflate the cuff rapidly and completely. So wait for 1 to 2 minutes before making further determinations. Then repeat the above steps once or twice if necessary to complete the accuracy of the reading. So ulitin ko lang po. Okay. Then close the valve again. Then so 120/70 po siya. Then if this is the client's initial examination, repeat the procedure on the client's other arm. So then document the respiratory rate, depth, rhythm, and character on the appropriate record. So then wash your hands and clean the sphygmomanometer with the antiseptic wipes.